It's 5:30 p.m. here in Seoul. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities. We'll cut into that right now as they begin.
We are joined by Mr. Kim Gun from Foreign Ministry, Mr. Kim Sung-gun from Education Ministry, Mr. Yoon Tae-ho from the CDC Headquarters. We have a sign language translation available as well. The briefing will be carried out by Mr. Bang Neung-hoo, Vice Head 1, Control of the Control Disaster and Safety Countermeasures. And it will be followed by Q&A session. First of all, here is Mr. Bang Neung-hoo. Let us now begin our regular briefing, and I am Bang Neung-hoo, Vice Head 1 of the Control Disaster and Safety Countermeasure Headquarters. Today, the Prime Minister Chung Se-kyun has carried out a meeting, convened a meeting, and we talked upon the issues of the stabilizing supply of masks as well as entry restrictions on South Korea. As of midnight today, those who are being isolated and quarantined are over 6,000. Of them, 130 have been discharged following full recovery, while 50 have died. So far, we have an accumulation number of confirmed cases that stands at 7,313. And over 181,000 people have been tested for the COVID-19. And I send my deepest condolences to those who have died. A week ago, on March 1st, the government said that the COVID-19 could spread to nationwide. And it also stressed that, and it also designated Daegu and the Gyeongbuk province as emergency areas, and we aimed at curbing the further spread of the virus. And that was mentioned just a week ago. To this, throughout the past week, many things have been proceeded. The special care zone of Daegu and Gyeongbuk region, over 3,000 diagnostic tests were carried out per day. And over 10,000 diagnostic tests were carried out throughout the country, and we identified these confirmed cases. As for the high-risk category, and we have obtained the list of Shincheonji Follow members as well as the trainees of the Shincheonji, and we are carrying out diagnostic tests for those with symptoms. And our headquarters also has revised our new guidelines, and those who are confirmed are being categorized according to their severity and are being transferred to hospitals. They are being hospitalized depending on their severity, and the government is increasing the number of hospital beds, and over 4,500 beds have been secured so far. As for those hospitals that lack the hospital beds, we also control so that many patients could move to other districts and cities for treatment. About 70 have been moved to other regions. And for the patients with minor symptoms, they have been moved to the life treatment centers, which are supervised by the medical staff. And as of now, we have about 10 of such facilities available and has admitted 2,000 more people. And we will continue to increase such life treatment centers. The government aims to increase our diagnostic tests going further. And due to the lack of hospital beds, the government also apologizes for the inconvenience that many confirmed cases had to face as they were quarantined at home. As for the life treatment centers, they were provided by many local governments, residents, as well as institutions and corporations. I extend my deepest gratitude to all of them, as well as the medical staff and all of those people who are working on site. And on top of this, 24 people have been dispatched to 24 people have been dispatched what will be released from these hospitals in Daegu, and we hope to see increasing number of people who will be discharged from these facilities. Thanks to such efforts put forth, the increase of the confirmed cases is being stabilized. In the Daegu city, we are almost at the completion of diagnostic tests on all of the Shincheonji members, and therefore we are seeing a trend of a decrease in the number of patients. As for Gyeongbuk province, we are seeing sporadic outbreaks among these facilities that are used by elderly people, and we are increasing our diagnostic tests for the Shincheonji members in this area as well. The local government of Daegu and Gyeongbuk province is cooperating closely with the central government, and the government is carrying out a large-scale diagnostic test, and we are witnessing sporadic outbreaks, so we are intensifying our quarantine measures on that part. As of now, the center epidemic of Daegu and Gyeongbuk province is going through a stable stage, and it looks like that we are not yet witnessing a trend where the virus is spreading rapidly across the nation outside of Daegu and Gyeongbuk province. And I urge all of the public to avoid from group gatherings, and I extend my deepest gratitude to all of the public for your cooperation for participating in social distancing. We haven't had to close down a city here in Korea thanks to all of your support. Unfortunately, we believe that it is still too early to say that we have been able to overcome the outbreak. Currently, we are seeing a change of the trend, and it's just the initial stage of the number of outbreaks being stabilized. And right now, this moment, we believe that it is time for our central government to increase our efforts to really curb the spread of the virus. The government is exerting our pan-governmental efforts and intensifying our quarantine measures, and I ask for all of the local governments to intensify diagnostic tests and epidemiological surveys, as well as identifying the confirmed cases. And I also urge all of the public, despite the conveniences that you may face, ask for your continued support going forward. If you take part in this overcoming the outbreaks, South Korea can overcome this outbreak. The confirmed cases is exceeding 7,000. However, a majority of the confirmed cases have been occurring on a single group of, and most of over 90% are related to Shincheonji Church, and many of the other confirmed cases were affected directly or indirectly by Shincheonji Church. And I believe that the South Korean quarantine measures is capable of controlling and curbing the spread of the disease. We have overcome SARS, MERS, as well as influenza, and we believe that we are fully capable of overcoming this outbreak as well. Above all, our government is committed to disclosing our information in a transparent and immediate manner. And in order to curb the disease, we believe that the public trust is of utmost importance. Moreover, many citizens have voluntarily participated in our efforts. They have been complying well with the personal sanitary practices as well as the social distancing. So these were very helpful for us to overcome the outbreak. And this is why we have avoided locking down cities and having an open society just like the current state. And the burdens of these are on each of our shoulders. We also are compensating for the loss of the quarantine. And also, we are seeking creative measures, and we are utilizing to our full extent our advanced IT technologies. Just like the drive-through screening facilities, as well as tracking down of the movements of the confirmed cases through GPS are of global status. And we believe that they have been really helpful in us overcoming this outbreak. And compared to any other countries around the world, Korea is one of the nations that is conducting the largest number of diagnostic tests. The accumulated number of diagnostic tests stand at nearly 190,000, and we conduct over 10,000 tests per day. Such advanced capability has enabled us to identify the confirmed cases at an early stage, and it is a very important step for us in overcoming this epidemic. And although it may sound ironic, I believe that the increasing number of tests also testify that we have an increasing number of the confirmed cases. And also our medical staff who are working on site are dedicated and committed to helping everyone out. I extend my deepest gratitude to all of them once again. Last but not least, in order for us to overcome the COVID-19, we are exerting our full efforts. Not only the Ministry of Welfare, but also all of the high-level personnel, including Prime Minister and the President, as well as other ministries, we are exerting our full efforts to overcome the outbreak. The local governments are collaborating closely with the central government to overcome the outbreak. And traditional quarantine measures have put in the center the early quarantine measures, and we believe that we as a democratic state, we believe that we have overcoming the restrictions that other countries are facing, and we are making a role model as for quarantine measures. As COVID-19 has similar symptoms like cold or flu, it is very contagious among people. Therefore, the traditional quarantine measures could not be very effective for COVID-19. The traditional quarantine measures can actually not be effective for curbing the spread of a social infection. And COVID-19 can only be overcome by the collaboration of by the governments as well as the public. Of course, we are going through difficult stages right now, but if we can overcome, we could definitely become one of the great role models in the international arena. I extend my deepest gratitude to all of you who have exerted your efforts to overcome COVID-19, especially the medical staff who are working on site with full dedication and commitment. We will spare no efforts in supporting all of you. A lot of people have donated greatly to the Daegu and Gyeongbuk province. I thank you once again, and I hope that you could bear with such inconveniences a little longer, and please participate in the government's measures to overcome COVID-19. Please comply with personal sanitary measures like washing your hands and coughing etiquettes, and please refrain from social gatherings. Last but not least, I would like to highlight the fact that we need to highlight the importance of solidarity and cooperation. We cannot stigmatize confirmed patients and we cannot discriminate them. Think of them as your family members, and we hope that solidarity can help us overcome the further spread of the virus. Just like we did so far, the local government as well as the medical staffs and the central government can cooperate to overcome the outbreak. Thank you very much.
Okay, and that concludes this briefing. Do stay tuned to Arirang TV for the latest on the outbreak in South Korea. We'll be back with our next newscast at the top of the hour. Bye for now.